Asthma is a chronic inflammatory disease of the airways that can cause wheezing and difficulty breathing, while bronchitis refers to the inflammation of the bronchial tubes, often resulting in a persistent cough. Asthma sufferers might experience symptoms such as shortness of breath, chest tightness, and coughing, particularly at night or early in the morning, whereas bronchitis may present with symptoms like a productive cough that brings up mucus, fatigue, and a slight fever. While asthma generally requires long-term management, including the use of inhalers and avoidance of triggers, acute bronchitis is often treated with rest, increased fluid intake, and in some cases, antibiotics if a bacterial infection is present. Chronic bronchitis, on the other hand, which is often associated with chronic obstructive pulmonary disease, COPD, may require more complex treatments. Risk factors for asthma include a family history of allergies or asthma, while smoking, exposure to air pollution, and frequent lung infections are common risk factors for bronchitis. Here's a detailed look at the many facets of these respiratory conditions. Etiology: allergic reactions versus infections. Asthma is a chronic condition where hyperreactive airways constrict due to triggers such as allergens, resulting in wheezing, shortness of breath, and chest tightness. The etiology often involves a complex interplay of genetic predisposition and environmental factors inducing allergic reactions. In contrast, bronchitis, characterized by inflammation of the bronchial tubes, is typically caused by infections, either viral or bacterial. While chronic bronchitis can also be due to long-term irritant exposure such as smoking, acute bronchitis is more commonly an infectious sequela. Distinguishing between these conditions is crucial since their management varies significantly, with asthma often requiring long-term inhaled steroids and bronchitis typically resolving with or without targeted antimicrobial therapy. Duration: chronic versus acute chronic. Asthma is typically a chronic condition characterized by inflammation of the airways, leading to wheezing, shortness of breath, and chest tightness. Its symptoms can be persistent or episodic, often triggered by factors such as allergies, cold air, or exercise. On the other hand, bronchitis can present in acute or chronic forms. Acute bronchitis usually follows a respiratory infection and manifests as a cough with mucus production, lasting from a few days to a few weeks. In contrast, chronic bronchitis, a subtype of chronic obstructive pulmonary disease, COPD, involves a long-term cough with mucus due to continuous inflammation or irritation of the bronchial tubes, often due to smoking. Distinguishing between asthma and bronchitis is crucial for effective management, with treatment ranging from bronchodilators and steroids for asthma to antibiotics, if bacterial, and smoking cessation for bronchitis. Age of onset: typically early childhood versus all ages. Asthma often emerges in early childhood, characterized by chronic inflammation of the airways that leads to episodes of wheezing, breathlessness, chest tightness, and coughing, frequently at night or early morning. In contrast, bronchitis can affect individuals at any age and is generally categorized as acute or chronic. Acute bronchitis, usually caused by viral infections, is prevalent in all age groups and tends to resolve within weeks, causing cough, phlegm, and sometimes wheezing. Chronic bronchitis, a subset of chronic obstructive pulmonary disease, COPD, typically occurs in adults with a history of smoking and is defined by persistent cough with mucus most days for at least 3 months in a year for 2 consecutive years. Understanding the age of onset is crucial for clinicians in differentiating and managing these respiratory conditions effectively. Primary symptoms: wheezing, dyspnea versus productive cough. When differentiating between asthma and bronchitis based on primary symptoms, asthma typically presents with recurrent episodes of wheezing and dyspnea or difficulty breathing. These symptoms are often related to certain triggers, such as allergens, cold air, or exercise, and patients may experience periods of relief. In contrast, bronchitis, especially chronic bronchitis, is characterized by a productive cough that lasts for at least 3 months, with recurring bouts over at least 2 consecutive years. The cough is usually more pronounced in the mornings and is often accompanied by the clearing of throat and production of sputum, which may not be seen in asthma. Understanding these symptomatic distinctions is crucial for healthcare providers to diagnose accurately and recommend appropriate treatment. Response to treatment, long-term management versus self-limiting, curative. Asthma is a chronic condition characterized by inflammation and narrowing of the airways, causing wheezing, shortness of breath, chest tightness, and coughing. Management typically involves long-term treatment strategies, including inhaled corticosteroids, bronchodilators, and avoidance of triggers. Patients with asthma usually require ongoing monitoring and therapy adjustment to maintain control over their symptoms. Bronchitis, particularly acute bronchitis, often stems from viral or bacterial infections, leading to inflammation of the bronchial tubes. It generally resolves on its own with time, and treatment focuses on relieving symptoms, such as through cough suppressants, pain relievers, and rest. While acute bronchitis is self-limiting, chronic bronchitis, a type of chronic obstructive pulmonary disease, COPD, requires long-term management similar to asthma, but with different therapeutic goals centered on preventing disease progression and managing chronic symptoms.